Hi, we're going to be talking about the diseases of the oral cavity within comparative anatomy and physiology. First of all, what we're going to be talking about today are gingivitis, periodontal disease, lip fold dermatitis, which we will also talk about with skin diseases, oral trauma, salivary mucocele, I'll describe what that is, and oral neoplasms or cancer. So our general signs that we will see with any disease within the mouth, we'll see increased salivation. The fancy term for that is ptyalism. We'll see halitosis, or we'll smell halitosis. It's a bad odor of the mouth. Generally results from bacteria being stuck within tumors or holes within the mouth that you normally wouldn't have a problem with. Pawing at the mouth, reluctance to chew hard food or toys, head shy, oral pain, behavioral changes, sneezing, nasal discharge, and facial swelling. Gingivitis is the first thing we'll see. It's just swelling of gingival structures. When we see it and we catch it early, we want to reverse that. We can reverse it if it's just gingivitis. If it continues on, it becomes periodontal disease. So often, before we see any periodontal disease, we will see gingivitis. Then we get inflammation and destruction of deeper structures, and that's what is periodontal. So those structures that surround the tooth. Periodontal pockets will form within that alveolar bone in that gingival sulcus, and eventually that periodontal ligament will be destroyed, which will then lead to the loss of that tooth. Here are the steps that we generally see. This is what a canine gingivitis, just a mild swelling at the edge of this tooth that has a lot of tartar on it, and here with a cat, this is just stage 1 gingivitis. Early periodontitis, which is stage 2, is where we start to get some pockets, a lot more swelling. It's a little bit painful, and we start to get an odor to the mouth. And this is how it looks in a cat. Doesn't look very significant in the cat. In fact, you don't see a ton of tartar on this tooth, but we're still having some deeper swelling here than just gingivitis. This is stage 3, which is moderate periodontitis. We'll get a much redder color. We'll start to see the root of the tooth, so we're getting loss of alveolar bone. You can see that here. And stage 4 is advanced periodontitis. It's a chronic bacterial infection. It's destroying gum, tooth, and bone, and it may be spreading throughout the rest of the body. So this is very serious. When we draw a line here between stage 2 and stage 3, that's the point at which we can recover the mouth to get it to be a normal mouth again. Once we hit stage 3, this is irreversible. We are going to lose some teeth. Plaque versus tartar. Plaque is just a biofilm. It's yellow in color. Sometimes it's hard to even see. It's formed by colonizing bacteria that is really trying to attach to the tooth. Dental tartar or calculus is a form of that plaque, but it is hardened. So once the plaque forms, if we don't get it off, it will harden into tartar. Remember, I do want you to keep an eye on this spelling of tartar. Tartar is spelled T-A-R-T-A-R. It is just a pet peeve of mine. I don't like to see it spelled T-A-R-T-E-R. So if you get tested on that and you spell it wrong, I'm telling you now that that's the way it's spelled. Diagnosis of gingivitis and periodontal disease requires a complete oral exam. And in some cases, we need to anesthetize or sedate an animal to do that. Because if we're going to be probing the depth of the gingival sulcus, that's a little painful. And we need to be sure that we can do that without getting bit. So if we're seeing presence of tartar on the teeth or inflammation of the gingia, we need to do this complete oral exam, put them under anesthesia, really test those depths and make sure we're getting a good picture of what's going on. What is the depth that is normal for a dog? Do you remember? 1 to 3 millimeters. For a cat, 0 to 1 millimeters. I hope you answered that as quickly as I hope you did. So dental scaling and polishing is the first treatment that we will do. If we need to, we'll extract. Sometimes we need to do some root planing, which is removal of the root. Gingival curettage, which would be scraping underneath the gingiva and making sure we're getting the tartar beneath. I want to go back to root planing. Root planing is not always the removal of the root. It's also sometimes reshaping of the root or removal of tartar off the surface of the root. Sublingual lavage, so really rinsing underneath the tongue, looking underneath the tongue, making sure there's nothing hiding under the tongue, like a foreign object or a mass. Antibiotics that we typically use for mouth bacteria would be clindamycin and rofloxacin, which is Baytril, and amoxicillin trihydrate clavulanate potassium, which is Clavamox. So not really expecting you to remember these antibiotics, but I do want to mention them because you're going to see them crop up here as we go through anatomy, physiology, diseases, and in our pharmacology class later the next semester. Prevention. Your first prevention that you need to do is to educate the client. We want them to begin early. We want oral prevention early. If we don't do oral prevention early, it's harder to get it started later on in life. If we can get them in the habit of brushing teeth daily, that will actually help to remove the plaque so they don't get a buildup of tartar. We want to do routine dental cleanings or prophylaxis with the veterinary technician. You are the one that is in charge of making sure these teeth stay clean. We want to treat gingivitis. If we find it, we want to treat it early. Some animals will require extraction of all teeth, and that is makes them much more comfortable. So a lot of people have a problem with extracting teeth, but if it makes the animal more comfortable, it's absolutely worth it. If they can eat hard, crunchy foods, that promotes better dental health. Lip fold dermatitis, clinical signs would be halitosis. It's a buildup of bacteria in a folded structure, so and a collection of debris in that lower lip fold that's going to cause halitosis. You may see sores or redness at the corners of the mouth, and they may be pruritic or itching at the mouth. Clinical signs would be, you see it most often in certain breeds, so breeds that have lots of extra tissue around their lower lip, Mastiffs, Newfoundlands, Great Pyrenees, any animal that has just a lot of lip folds there. We want to rule out other causes of halitosis and lip fold disease with a complete workup and blood work. Periodontal disease, Demodex infestation will cause this. Pemphigus, which is an immune-mediated disease, will cause a lip fold disorder, and renal failure can cause halitosis, a very bad halitosis as well. Treatment for lip fold dermatitis is a dental cleaning. We're going to then flush and clean the lip folds with a chlorhexidine solution or a benzoyl peroxide shampoo. We're going to dry it out as much as possible. If it's allergy related, I do see this in dogs that don't have like lots of lip folds in that area, but I do see it if they have allergies. So they eat this food and they have an allergic reaction right at the place where they are eating the food. And so that will cause them to itch, which will bring in bacteria and cause a dermatitis. So we want to treat that underlying disease and maybe do a surgical resection. If they need a little plastic surgery to make them more comfortable, absolutely do that. We want to educate the client to keep those folds clean and dry. We want to clean it daily for the rest of their life. Hopefully they chose a breed because they know that they are going to have to do this, and they didn't choose a breed just because they liked the looks and didn't realize they have a lot of work to do with that breed. We can use cornstarch, but first we have to dry the area and then use this drying agent to keep it dry. A food exclusion diet is when we change the food to provide a completely new protein because they're mostly develop allergies to proteins, and we only use that certain protein in their diet and then add other see if the lip fold dermatitis gets better or goes away, and then we'll slowly add more proteins in to see what they're allergic to. So that's what a food exclusion diet is, and what it's doing is trying to diagnose if it's due to an allergy. And then keeping the teeth clean. Good dental hygiene will keep the bacteria away from those lip folds. All right, oral trauma. So any sign of head trauma could cause oral trauma. Tylism or increased salivation would be a clinical sign. If they're unable to close or open their mouth because the joint isn't working, that's a sign. If they don't want to eat, they're unable to eat. Or if you actually see a foreign object in the mouth, that can be a sign. So we want to do a physical exam of the oral cavity, and sometimes, especially if it's painful, we need to put them under anesthesia to do that. And if you're not finding anything, sometimes we actually have to do x-rays to see a linear foreign body. Now, some of the things that I've seen as a foreign body in the mouth, bones or sticks that get caught on the roof of the mouth, and you'll see them pawing and pawing and pawing at their mouth trying to get it out. I've also seen sticks. They're chasing a stick. It gets stuck in the ground. They open their mouth to go get the stick, and it actually pierces them in the back of the throat. I've seen sticks be embedded in the back of their throat. We're able to remove most of it. If a splinter gets stuck in there, it can migrate through the body. I've had one migrate all the way into the chest cavity and kill the pet. So we want to be real careful to make sure that we're looking for those linear foreign bodies as well. Sometimes cats will have strings caught on their lower tongues. You have to open up their mouth, push on their in between their mandible and on their lower chin, and push up the tongue. You're pushing it up from the outside, and look under their tongue for that foreign body. A string foreign body wrapped around the base of the tongue of a cat can kill a cat because it will cause a foreign structure in the intestines, and it will block the intestines and kill the intestines. All right, treatment for oral trauma. Obviously, it depends on the extent of the damage. We want to start by controlling bleeding and making sure that they have an airway. We may need to provide supportive care very quickly, so fluids and pain relief. If they have chemical burns, we want to lavage that mouth very carefully. We want to repair and extract damaged teeth and repair fractures surgically as needed. We don't want to leave young animals unattended. We want to kennel them. If they're left unattended, often they make poor choices. We want to keep pets fenced or on a leash, keep them away from large moving vehicles. Animal-proof the environment. So talk about cords, chemicals, needles, thread, bones, etc. Make sure that we have a safe environment for this small animal. Seek care for any head injury. Damage to the mouth could indicate we have damage to the brain. Teeth sometimes are able to be repaired. Often it requires a specialist. And animals can still function if they lose a good bit of their tongue tissue. So we don't want to be scared of making sure that we're taking care of the animal. Trauma to the teeth. These are problems with animals who are chewing on hard substances, often bones, sometimes even hard sticks. The kennel itself can cause these fractures. I don't recommend that you chew things to animals, to dogs in particular, that are harder than the tooth or as hard as the tooth. So if it's a bone, I don't recommend it. If it's a really hard nylabone, I don't recommend it. It should have a little bit of give to it, or you'll get this problem. A slab fracture is bad. If we see a slab fracture, not only is it painful because this little slab of tooth is fractured off this premolar, and every time they chew on something, it is pushing up into this gum line. That gets some increased bleeding. All this bacteria that's on the tooth is going to get into the bloodstream. That's going to cause a problem. Now, I don't see a pulp exposure like I do here. And in fact, this slab is missing, so they must have broken it off at some point. But when we have pulp exposure, that's bad. These teeth need to be removed. All right, a salivary mucocele is really the only recognized disease of salivary glands in dogs. So now we can see certainly cancer of this salivary glands, but this is a different disease. Often we see it in dogs. We don't know what causes it, but sometimes we'll see it in cats secondary to trauma. So if something blocks the duct, the salivary duct, then we'll get a buildup of this saliva within the gland itself. What it looks like is a slowly growing, non-painful fluid-filled swelling on the neck, so where the parotid gland would be, or under the tongue. it will become uncomfortable. So you can push on it, it's non-painful, but it becomes uncomfortable because they don't have enough saliva in their mouth, or there's enough pressure with that fluid-filled swelling under the tongue to make it uncomfortable. So they'll be reluctant to eat. They may have difficulty swallowing because they don't have enough saliva to help them. You may see blood-tinged saliva. And sometimes respiratory distress. If it becomes big enough that it's covering over the trachea or the glottis, they will have difficulty breathing. So we base it on the diagnosis on clinical signs. We'll do a paracentesis. Basically, we'll stick a needle in that swelling, and we'll put it on put the fluid on a slide and look at it. And what we should see is kind of a stringy blood-tinged fluid with few cells, and that's just saliva. We can do a sialography, which is a retrograde, which means it's going backwards, infusion of a water soluble angiographic contrast material. So this is material that is denser than our body tissues, so it will show up on an x-ray, and we put that into the duct of the salivary gland. Treatment is we aspirate the fluid. Now, sometimes if this continues, we'll have to continuously aspirate the fluid. We can do a surgical drainage where we put a hole in the gland and maybe a drain and allow that to drain over time. We may have to remove the gland completely. Now, when we remove the gland, it's a large structure, we do want to put a Penrose drain in. That Penrose drain is simply a flat latex tube. It's a flat tube, but it does have an opening in the middle. And we place it in that wound, that surgical wound where we've removed the gland, for about, I have 5 to 7 days, sometimes even 3 to 4 days, because the body likes to fill any gaps in the body with fluid. So we put the drain in there is because we're removing this gland and creating a space in the body. And then with that drain in there, it will remove the fluid and keep the tissue together so it will heal together. So we don't know why these salivary mucoceles occur. Sometimes it's due to trauma. If we don't remove the gland, it will continue to produce fluid. If we can't get the duct open, then we will have a large mass appear. Sometimes it spontaneously resolves itself, so we can drain the mass and see if it gets better. This is a sialogram in a human, but it shows you this contrast material going into the salivary gland through the salivary duct. Neoplasm cancer is fairly common in both dogs and cats, but generally older animals. There are malignant melanomas, usually in male dogs, and those with pigmented mucosa. These are rapidly growing and they have early bone involvement, so they're bad tumors to see in dogs. Squamous cell carcinomas are usually found in cats. They're usually ulcerative, erosive. They invade the mucosa, the bone, and the lymph nodes. So again, squamous cell carcinoma, oral neoplasm in the cat, really bad. There are some benign tumors. There are papillomas, which are pale cauliflower-like growths. They're kind of ugly, but they're viral, and a lot of times they regress on their own. There are also epulides, which are slow-growing growths, but they can be locally invasive, and they can actually eat through the bone. We see these epulides a lot in shorter-faced breeds, especially in boxers. So these little growths, and they're typically just the color of the skin beneath it, so they can be pink or they could be black. Clinical signs of neoplasm, it will depend on where they are and what they are, but you may see abnormal food prehension. They'll be eating funny, tyelism or salivating. Sometimes it's blood-tinged, halitosis because bacteria gets trapped around those neoplasms, tooth loss, and oral pain. Diagnosis would be histopathology of the mass. So we can do a fine needle aspirate or take out a portion of the mass and take a look at it or send it away. CBC and chemistry, we want to rule out metastases and evaluate bone involvement. So we'll take x-rays of the chest and x-rays of the mouth itself, and then a lymph node biopsy to see if it's metastasized into that lymph node, the nearest lymph node. Surgical excision, we need to get a 2 centimeter tumor-free margin. That's a lot of tissue in a mouth. If the bone is involved or suspected, we may remove a portion of the maxilla or the mandible. That's called a hemimaxillectomy or a hemimandibulectomy. We could do radiation and we can do chemo. Cisplatin is used for dogs with squamous cell carcinoma. Doxorubicin and cyclophosphamide is used for cats with squamous cell sarcoma or squamous cell carcinoma or fibrosarcomas. Prognosis with a malignant neoplasia is guarded to poor. With benign lesions, we could do a surgical resection and or radiation therapy, and we can have a good prognosis. Sometimes we need nutritional support through a feeding tube if a portion of the jaws are removed, and we'll see that especially in cats. This is another disease of the cat. This is something that we are seeing more and more of. I'm not sure really what causes this, but it could be secondary to gingivitis or periodontal disease. It almost looks like a severe allergic reaction to the bacteria that's within the mouth. We see this stomatitis or inflammation of the mouth within cats, and it's mainly made up of lymphocytic and plasmacytic cells. So these are the immune cells. They cause red, swollen, ulcerative, painful lesions within the mouth. They're very painful to the cats. It's hard to eat, it's hard to swallow. They often be painful at their mouth. They may be rubbing at their mouth quite a bit. It may be secondary to gingivitis or periodontal disease, and a lot of times we actually have to remove all of the teeth that are involved. Put them on steroids to reduce the immune response, and then an antibiotic like clindamycin and rofloxacin, which is Baytril or doxycycline. If you have any questions about oral disease, this is actually a pretty quick run through most of the oral diseases that we will see. Just bring them to class.